and be well managed, really. But it's at this point that I will want to revert back to my friend Gertie, and I want her to let us know what are the specific instructions that we give to these patients whom we ask to go home. They are symptomatic, they've tested positive. What are the instructions that we give to them? I'd like Gertie to come in at this point.
Thank you, Dr. Akimbo. So I guess we're moving to Q&A, but the first question has been given to Dr. Gertie.
Yeah, I intend to come back after Gertie answers these questions to complete my talk.
Okay, so the patients that are symptomatic, right? A lot of them, if they're not sick enough for me to admit them, I tell them to stay home, self-quarantine. I manage them at home. I call them, depending on their severity, every day or two to check on them, myself and my staff. And so we keep them home in a separate room from the rest of their family, if they have family at home. And they tend to use a separate bathroom. If you're in a house that you have separate bathroom, their cutleries, everything they use is like they're truly on quarantine. Now, in a situation where they cannot absolutely be in quarantine, maybe they have to cross path with others, we advise every one of them to wear face masks, because they've shown in different studies that when the face mask is more important for the person that has COVID-19. And the reason we ask everybody to wear it is because some people may have COVID-19 and we don't even know. Yes. So if somebody wears it and they have COVID-19, even if the next person doesn't wear it and they don't have COVID-19, they have only a 5% chance of transmitting that virus. Without a mask, they have, if you have no mask, you have almost, 90-something% chance, right? If I don't have COVID-19 and I wear a mask, and someone has COVID-19 and they don't wear a mask, guess what? Even though I wear a mask, I still have 70% chance of getting the virus from that person with COVID-19 that's not wearing a mask. Now, if I have COVID-19 and I wear a mask and you don't have it, then I have 5% chance of transmitting it. But if we both wear a mask, then it gets reduced to 1.5% chance. This is why it is so crucial. It's so very important for everyone to wear a mask. So you asked me about the patients at home. This is how I manage. The ones that we have in the hospital that may still be positive for COVID-19, but their symptoms are better, they can breathe better, their symptoms of cough is less. Yes. Depending on their debility, if they are too weak and the family cannot take care of them or will be exposed too much and the family doesn't want to do that, we can send them to what we call long-term acute care facilities or skilled nursing facilities, where you have COVID wards, and they keep these patients there, and they have nurses that are trained to take care of them until their debilitation improves and they can be sent back home, right? The ones that can go home, we advise the same thing as we do with the other patients. Now, there are 3 conditions to come out from quarantine. And I don't know if some people here have watched videos that I'm putting out there on YouTube, but those 3 conditions are, most of people here in America, once you've had it, they don't do retest because the testing is scarce. So they want to test the people that have not been tested. They're not interested in testing the people that they already know that have COVID-19. Ideally, that's what should be done before you return these patients to the normal population. But then we advise the patients to, if your symptoms have improved, if you've had no fever for 72 hours and your symptoms, the CDC says 7 days from the symptoms. I think we should extend it to like 14 days at least, especially because we're not testing these patients. I have had patients who have been tested 4 weeks into it are still testing positive. The other day I got a call from Georgia, Atlanta, Georgia, and it was about this nursing home where these patients tested positive. I've been repeatedly tested positive for the past 1 month. And the patients are anxious, they want to get out of isolation. And I was like, no, my advice is to keep them there. Because if they're still shedding the virus, they run the risk of infecting others once they get out of isolation. So that's the same advice I will bring you. Thank you.
Thank you, Dr. Gertie. Any final thoughts, Dr. Akimbo, before we move into Q&A proper? Dr. Akibo, are you there? Okay, I think you may have frozen. Okay, let me start with some of the questions we already have, Dr. Gertie. I think a couple of them are more medical than I know. So it says HCQ has been used for PrEP by some clinicians and got good outcome. What can you say about this?
Okay, so this here, like I tell you, it's people say they get good outcome, and I'm telling you, I'm getting good outcome without treating my patients that are home with HCQ. So you go figure. Much is going to be known more about this virus, but for all intents and purposes, I haven't seen much of a difference. Now, I have not used HCQ as pre-exposure prophylaxis. I have not ever used it, and I don't advise anybody to use it as pre-exposure prophylaxis. And that's just me. We have no evidence that it works. And when you say good outcome, if you're giving somebody pre-exposure prophylaxis and they haven't even gotten the disease, how do you know it works? Which population did you test it with? I believe in randomized trial, double-blind control. Until we have that to prove, I would not practice that, because there is really no way of telling. Like I'm telling you, I have a lot of patients. I'm an infectious disease specialist, right? I have a lot of patients that I haven't given pre-exposure prophylaxis and they're doing fine. So how do you tell?
Mm-hmm. Thank you very much for that, Dr. Gertie. A second question says, study shows that it was discovered that a lot of Black people who died of COVID-19 were vitamin D deficient. And it is because melanin on our skin as Black people blocks out vitamin D. How true is this?
Okay, I can tell you right now, 90-something% of the patients that I test, and that's white and Black, are vitamin D deficient. Because in this day and age, especially here in the Western world, in America, people don't really go out that much in terms of walking under the sun. And that's where we get the vitamin D. So I would say 90-something% of my patients are on vitamin D replacement therapy. So I really think that we need to look for other causes than vitamin D as at this time.
Thank you, doctor. I think this is another question from one of your colleagues. He says, we are just discussing on COVID-19 group about the TAT for PCR testing. Some say it is 60 days and is limiting clinical applications. Please, what is the TAT for testing using PCR in the US?
What is he describing as TAT?
Okay, I'm sure the person is listening. So if you are, can you unmute your mic and just clarify what your TAT is, please? While we're waiting on that, another question says, has there been any form of clinical trial for the herbal medicine discovered in Madagascar?
I saw that, I think it was a video on WhatsApp about Madagascar. I can't really talk much about that. I don't want to becloud any judgment, but as a physician, I can only speak for what we do in the medical community. If you have a drug, we have to put it through a double-blinded study, right? I don't know. I was researching to see how many people. Thank you very much, Augustine Onyagala. TAT, I see turnaround time. Okay.
Turnaround time, yes.
Yeah. So Madagascar, how many patients have they tested? That would be the first question. And then this treatment that they have. I've just presented that you may have about 25 to 50% of the population not having any symptoms at all, and about 81% of them having mild symptoms, which needs absolutely no treatment, right? Except you give them Tylenol, paracetamol, multivitamin, vitamin C. So have you done any study to show that when you do that and then you give this herbal medication, the herbal medication was better in terms of returning them back to normal faster or preventing them from getting worse? That's the only time I can actually talk about it. I cannot talk about stuff that has not been put through the rigors, because like we know, 81% of the patients have either no symptoms at all or mild symptoms and will be fine, regardless of what we do or despite what we do.
Thank you very much. Before we return to Augustine's question on the TAT, I have a 2-in-1 question for you here. So somebody says here, kits are being used in some states to test for COVID, but none has been validated and approved by government. Doesn't this present a public health problem? That's the first aspect of the question. An add-on question to that is, Senegal recently made news about their $1 test kit. Do you have any information on the validity of this?
Okay, so I'll take the first part of the question first.
Okay.
Like I mentioned in my presentation, that the antibody test, because of the nature of COVID-19 and everybody is frantic, the governments want to be seen to be doing stuff. Normally, the FDA have protocols for approving tests, right?
Yes.
Well, at this time, they kind of relaxed it for COVID-related issues. And so you have people that have valid tests and you have people that don't have valid tests. Like I mentioned in my presentation, the FDA is going back to reevaluate this. So they're putting a stop to this stuff because people are finding out that you have totally unvalidated tests that are giving us results. So say if somebody is actually positive and the test is saying it's negative, then that's a risk. So yes, I agree, it's a public health problem, and the FDA is re-examining their position right now as we speak. The second part of that question was the Senegal and the $1 test. I applaud Senegal, but I want us to remember that Senegal, that particular lab is not new. That lab is funded by France, I think. So that lab is as qualified as any lab in the Western world. And so if you say they're producing a $1 test, I think it's an achievement. But you think about $1 in Nigeria, how much is that?
Well, between 360 and 480, depending on which exchange rate you're using. All
right. So you see, it's commendable, but they have the backing of sophisticated labs from abroad. That lab actually is just like any lab in the Western world that just located in Senegal. Go back and look at the history of that lab. I would hope that Nigeria can, formulate such in terms of collaboration with other, people, other states or organizations that can present such a lab. But that lab is not new at all. They have excellent experience.
Thank you very much, Doctor. Now, going back to Augustine's questions, the question says, we are just discussing on COVID-19 group about the TA turnaround time for PCR testing. Some say it is 60 days and is limiting clinical applications. Please, what is the turnaround time for testing using PCR in the US?
Okay, so when we first started, because a lot of people were testing and the labs were overwhelmed. So it was coming back like 9 days, 10 days. I did mine in March. It took about 9 to 10 days. And I'm a doctor, I'm an infectious disease doctor. It's just because the labs were overwhelmed. The turnaround time shouldn't be that long, to be honest with you. The turnaround time, you should get those test results back within 24, 48 hours max. That is where you have the resources to do it. Now it's better because you have people jumping into the market. When they first started testing, it was only the CDC that you could get tested. So when I had my first patient in the hospital, I had to go through protocols, jump loops, go through the health department of the state to get to the CDC to be able to test my first patient. It was too much protocol. I had to sign this paper, do this. No. It made it really cumbersome. And we had to keep this patient in the hospital for almost a week to get the test results. And over here, hospital beds, you can't keep patients for that long, especially if they're already improving. And yet we didn't have the test results, but they got better. So the CDC, the CDC liberalized it and said the state health departments can also jump in. And then when they saw that the demand was so much, they got the private labs to join in. And I think that this is where we are missing the mark in Nigeria. Where are the public-private initiatives? Where are the private labs? In situations where the private labs cannot meet the demand because they don't even have the infrastructure, what is the government doing to help them get the infrastructure, to help the government test the population, to help us get to some normalcy? That was a rhetorical question, by the way. So I hope that answered the question for the turnaround time. The turnaround time should be max 48 hours, 24 to 48 hours. Hello?
Hello, we're here.
Okay, I couldn't hear anybody again. So I wasn't sure if you were talking.
Hello, doctor, can you hear me?
Yes, I can hear you.
Okay, yes, sorry. I said on the drug, remdesivir, the question is that it's an expensive drug, and how can people from the low and middle income countries benefit from it?
That's where I think certain NGOs should be able to come in. This drug, like I said in my presentation, they think it may be promising. As of now, that's the best thing we have. But even here in America, from what I understand, it's going to be a very expensive drug. It's done intravenously, so it's not something that you can ideally give a patient in the home or something like that. We would need help. We would need help from humanitarian organizations, NGOs that want to help people, because even here in America, the price is going to be a problem.
Okay, thank you for that. One final question, but it's going to be two questions in one again. So the question says, in Nigeria, we currently have less than 2,000 confirmed cases of COVID-19. Do you think it's advisable we open our economy now? That's one aspect of the question. The second aspect would be, what can be done in terms of mass testing in Nigeria? The statistics going out there is that we've tested anything between 15 and 20 something thousand people, depending on whose statistics you're looking at, in a country of 200 million. So how do we go about mass testing or increasing the testing capability of both NCDC and the private sector participants? But more importantly is that since the government is relaxing lockdown on Monday, your personal opinion, not professional now, is this right? Is this the time to do this?
The problem I see in Nigeria, and Nigeria in particular and the rest of Africa in general, is multifaceted, is hydra-headed. So I'll take us a little back. In the Western world, when they shut down, they did the lockdown, they try to provide palliatives for their people, right? They try to provide economic cushion for the people. Most people, depending on your income, will get something from the government. If you have a mortgage, you can talk to the bank to defer your payments for 90 days. In Nigeria, I mean, like some of my employees, when I had to shut down because we're running low for PPEs, some of these people don't play. They'll go for unemployment because their hours have been cut. And they're getting money from the government every week to be able to take care of their needs. We don't have the same situation in Nigeria and the rest of Africa. It is lockdown, and the people are supposed to fend for themselves. They have all these initiatives of people donating, but most people you ask didn't get anything from the government. It's kind of hard to ask them to stay at home for weeks and weeks upon weeks without them having much hope for subsistent living. Like, what do they eat? What do they feed their children when they're hungry? So those things go hand in hand. Our economy is already bad. We depend heavily on oil. Because of the lockdown worldwide, people are not using oil. We not only depend on oil, we have oil, right? We drill it, but we're not the one that do the processing. We have to put it in ships and ship it out. And we have to pay rent for this ship. I worry personally, and you said this is not on a professional level, this is on a personal level. I worry about the Nigerian economy. By the time COVID is done with us, America is probably going to go into a recession. I think ours might be worse than recession. So we have to, when we profound solutions, it cannot be a one-size-fits-all because the circumstances are different. What I think we should do in Nigeria is, yes, we may phase in return to normalcy, but do it in a very appropriate way, that if everybody can wear a mask, if the businesses can provide areas where people can go and wash their hands, businesses to provide sanitizer, if the government can even put a lot of, areas where people can easily wash their hands, and everybody adhere to wearing a mask and trying to maintain some degree of social distancing, we may put certain populations back into the normal circulation and the economy. The people that are most at risk are the elderly and people that have multiple other comorbidities. We may shield those people. Can the government help our elderly people, give them palliatives, give people that have comorbidity some kind of incentive to stay home? Because if they are exposed to COVID-19, they are the population that is most at risk to present in a severe form. That would be my personal opinion. Yes, I think the economy should, in Nigeria, by the way, and other African countries, should start to go back to some normalcy, albeit being phased in this order, and it will produce less damage, because whichever way you look at it, there is going to be some collateral damage. Which one is better? It's like between the devil and the deep blue sea.
Thank you, Dr. Gertie. We're on the time for Q&A, but I have one more question for you. I'll ask you the question, and while you're thinking of an answer for us, I'll read out some contributions by Dr. Ogunaya. So the question is this, Dr. Gertie. Somebody had mentioned to me in the private chat earlier on this call that, a lot of your presentation seems to be skewed towards medical practitioner and medical practice. So what are they to take away? So I'm going to ask you clearly, with this lockdown relaxation coming on, at the beginning of COVID, there were a lot of DIY exercises people were told to do, breathing exercises and so on and so forth, just to check yourself, make sure you're okay. What exercises or what can you tell us to do as we start going back to normalcy, so to say, to check ourselves beyond the normal? Wash your hands, use the face mask, use sanitizers. If you find yourself coughing, you find yourself feeling unlike you, what are the things you can do as a first step to assess yourself before you reach out for medical assistance? And while you're thinking on that, I just want to read out some comments here by Dr. Gonaya. He said, we should all remember that most patients may even recover without treatment, and that the DG of the NCDC already addressed the Senegal's rapid diagnostic testing, that one, it's not coming out anytime soon, and it actually is not it's not $1. The problem with RDTs are the low specificity and sensitivity. If you use RDTs, it may tell you you are negative when you are COVID-19 positive, which is very dangerous for our setting. Hence why the Nigerian context is sticking to the PCR test. I think you already alluded to this, doctor. And they said they have a laboratory network already in Nigeria, which has been set up by the NCDC. In talking about, I think it must be referring to the remdesivir here. It said the drug reduces admission time by 2. It does not necessarily cure COVID-19. Even in the US, there are some citizens who did not get stimulus packages. Oh, okay, well, this is not economy. It is a global problem. A significant proportion of our people are daily wage earners, hence total lockdown not feasible. Yes, in agreement. So far, for a resource-limited setting, Nigeria and the physicians are doing the best measures they can. Even developed countries are recording high death rates and crumbling under the weight of the pandemic compared to Nigeria. We have strong informal community health networks. Okay, thank you, Dr. Tonaya. So, Dr. Gertie, last comments from you regarding what can we do?
In terms of if somebody becomes symptomatic during this period, I would say first thing you do, you call your doctor and you start taking Tylenol, paracetamol, multivitamin, vitamin C. If you have zinc, you take it. But call your doctor, see if you can get tested, and then go from there.
Thank you very much, Dr. Gertie. It's been wonderful having you. Quite informative.